Alright, my name is Samantha. I'm going to be going over body regions and terminology. To start off, we have the hallux, which is your big toe, the axillary, which is your armpit, the buccal, which is your cheek, the pollex, then we're going to have the patellar. Next, we're going to have oral. Then we're going to have mental, which is your chin. We're going to have the brachial, the antebrachial, the crural, your umbilical, which is around the navel, and your femoral. If we go ahead and turn him around, we're going to have the calcaneal, which is your heel, your sural. Then we're going to have the popliteal, which is right behind the knee. We're going to have the olecranon, which is behind the elbow. We're going to have the acromial, which is your shoulder, and then the occipital finally, which is the back of your head. I'm also going to go over some directional terms. The first one is your head is superior to your sternum. The olecranon, which is the back of your elbow once again, is going to be distal to your acromion, which is going to be your shoulder. Then you have the axilla, which is your armpit, and now that's going to be proximal to the brachium, so your arm. And then next we're going to have your nose is medial to your eyes. And then your elbow, which is going to be proximal to your carpus, so your wrist. Then next we're going to have your sternum is anterior or further out than your vertebral column, which is going to be right here. Next we're going to have the umbilicus, which right here is going to be inferior to the sternum. So sternum and then your umbilicus. Then your patella is going to be proximal to your tarsus, which is going to be your ankle. And the very last one is going to be that your ears, which would be right here, they're not on the skeleton, are going to be lateral from your nose. Then to finish off, we're going to go over the abdominopelvic regions. Alright, so if we're going to be right here, we're going to go ahead, and this is going to be your epigastric region, your umbilical region, your hypogastric region. Then we're going to have your right hypochondriac, left hypochondriac, right lumbar, right iliac, and your left iliac. Last thing we're going to go over is a few organs that are going to be in each of these. So to start, it's going to be your liver and gallbladder. Then we're going to move over and we're going to have your liver and your stomach. Next, we're going to have your diaphragm and your spleen. Going back to the right lumbar again, we're going to have your ascending colon, which goes up, and your liver. We're going to have your transverse colon. We're going to have your small intestines. Then over to the left lumbar, we're going to have your descending colon, your left kidney. Going down to the right iliac is where we're going to have your sacrum and your appendix. Down to the hypogastric once again is going to be your urinary bladder and your reproductive organs. And then lastly, in the left iliac, we're going to have your descending colon and then your sigmoid colon. And that completes my presentation.